Probably around 13, almost 14 years ago, my daughter, who was, and still is a nurse, thought she detected something in my breathing, and I was smoking at the time. And she hooked me up with Dr. Wiley, who was someone she knew from the hospital. And he brought me in and did this treadmill stress type pulmonary evaluation. And we came back and discussed it. He said, well, you got COPD. And then we talked about it. And the options were to leave the cigarettes behind, which took me a while to get through that in my head, but I did. Assign me some medications, which I still take. And we talked about the fact that once your lungs are wrecked, they're wrecked. Okay. And then considered the various options, and for me, the only option was to keep going. I had a lot of things I was doing and wanted to do. So I started to get serious about exercising, primarily with either a stationary bike, a regular bike, or more lately a treadmill. What I've noticed over time is I definitely can do more now than when I was diagnosed. I have more stamina. Now, I'm not saying I got cured because my lungs are still the same. I think the diagnosis, what as bad as it is not as bad as the other stuff. I think COPD is quite manageable in terms of living and being, you know. So when I approach exercise, I have developed little techniques about my breathing, which seem to work well. So instead of trying to gulp like a fish and suck air in, which is just hitting a wall of stuff that needs to be out of there, basically, what I do now is make sure that I'm evacuating my lungs as I exercise. So I concentrate on exhaling. And the in part follows. So and what I found is that allows me to keep going. Push yourself a little bit. See if there's a place you can get to where you know what your limits are, and work on it, increasing.